Health officials are on high alert this morning in Texas and worldwide due to the deadly hantavirus.
Yeah, 2 Texans are being monitored right now after they came home from the cruise ship at the center of that outbreak. Now, U.S. health officials confirm the virus on the ship is the rare strain that is transmissible from human to human. It's also believed that a Dutch couple in their 70s died after contracting the virus during a birdwatching trip in Argentina prior to joining that cruise. A 3rd passenger also died, and as many as 5 others are being treated for symptoms. The World Health Organization says at least a dozen countries are monitoring about 30 people who had disembarked the ship before the cases were confirmed.
I think the key for us is making sure we're in touch early and often, right? As we're monitoring really closely, that way we're able to really wrap the public health apparatus around them and do the work that we know how to do.
146 people from 23 countries are still on board that cruise ship, according to the operator Oceanwide Expeditions. They are scheduled to arrive in Spain's Canary Islands this weekend before being flown back to their home countries. And we know many of you at home might be wondering, what is the hantavirus? And especially with the memory of the COVID-19 pandemic still so painfully fresh to all of us.
Yeah, understandably, you may be questioning if there's a greater risk of an outbreak beyond the cruise ship. Well, here locally, the key takeaway is that it is not spreading widely to person. Now, the biggest risk comes from exposure to rodents or contaminated spaces. We spoke to Dr. Jose Serpa with UT Tyler School of Medicine, who told us the virus is rare, but it can be very serious. Dr. Serpa says that the strain involved in the cruise-related outbreak is especially unusual because of it's one of the only types of hantavirus known to spread through close person-to-person contact. Still, he stresses this is not another COVID situation and says the biggest focus should be on prevention and awareness.
How do we prevent hantavirus infections? Basically, limiting or avoiding our contact with wild rodents. Check our houses, making sure that our houses are not infested with these mice or rats.
Dr. Serpa says early symptoms of hantavirus can look a lot like the flu, including fever, fatigue, even muscle aches and headaches, cough, and shortness of breath. The CDC says that the risk to the general public as of this time remains low.